Did you know nearly 2 in every 10 women experience chronic pelvic pain? Yet many suffer in silence due to unfounded myths about this condition. Today, let's set the record straight. Hello, I'm Dr. Sylvia, a general practitioner and women's health specialist. This is AskAwayHealth. Before we dive into unpacking and untangling these myths, what is chronic pelvic pain? Well, chronic pelvic pain is defined by the Royal College of Obstetricians and Gynecologists and the American College of Obstetricians and Gynecologists as persistent pain lasting longer than 6 months, located in the pelvic region or the area around your hips, abdomen or lower back, and severe enough to affect your daily life. It's a condition that affects women more than men. About 17% of us will experience chronic pelvic pain. Women of childbearing age tend to experience this condition more than others, and it has a higher prevalence in Black women than other ethnic groups. Myth number 1 is that chronic pelvic pain is always related to your periods. Now, I can see why this may be a reasonable thought or consideration, but if you think about it briefly, you can put holes in that idea. Because while cramps are a common cause of chronic pelvic pain, having it happen persistently could signal other conditions like endometriosis or fibroids, ovarian or even bladder problems. The most important thing is not to give in to or accept unexplained chronic pelvic pain as part of life. Please do keep track of your symptoms and seek help if this pain is recurring consistently and lasting over 6 months. The next myth is that only older women get pelvic pain. I feel this is an idea that we accept because as women grow older, conditions like arthritis, menopause, and other issues can set in, which are also associated with pain in different parts of the body. But assuming that only older women experience chronic pelvic pain is totally wrong. As I mentioned earlier, the women who experience chronic pelvic pain more tend to be within the childbearing age or before menopause. Pelvic pain can potentially affect all ages. Teenagers with polycystic ovary syndrome, young athletes experiencing muscle dysfunction to their pelvic floor, somebody who has developed a urinary tract infection at any age. It's also important to remember that the pelvis is full of many different organs, and any of them could have a problem leading to pain regardless of your age. So, never assume the cause of the pain. Have it checked out so it's treated effectively. One treatment is pelvic floor therapy, which can be very important, like I said earlier, for muscle dysfunction in athletes or anyone else. Myth number 3 is my pet peeve because it reduces or minimizes my experience as a woman when someone else tries to tell me how I am feeling. And that is that pelvic pain is all in the head. Pain is real. Even though we don't have simple ways to measure pain, we can't assume somebody else's pain or the degree of pain somebody else is experiencing, whether we are their friends, family members, or doctors. One way I assess pain when I'm talking with my patients is by asking, what is your pain score from a range of 1 to 10? It's a rough way I use to gauge the person's own experience of their pain, not by looking at their face or how much they are rolling around, which can provide some guide, but 10 usually refers to severe pain, while 1 is no pain at all. So if, for example, I asked you to keep a pain diary, you can create a graph that has your pain scores over a few weeks or months or whatever the case may be, that shows how the pain either dips or peaks during that period, and that can be quite useful. Conditions like neuropathy or adhesions or chronic inflammation can develop where sometimes there is no obvious physical symptom, but they're causing pain. It's also a good way that you can use to advocate for yourself with doctors, using a symptom journal, or bringing a friend who can clarify the impact of your pain while consulting the doctor. For more tips about this and the issue of medical gaslighting, check out this video here where I discuss the subject in more detail. Myth number 4 is the one that says, oh, you just need painkillers, you'll be fine. So why is this a myth? I don't mean that if someone has chronic pelvic pain, they shouldn't get painkillers. But please listen, this is really important. Pain is a symptom of something. While removing the pain in that moment is essential, working out the cause is equally crucial. If you only mask the pain by only giving painkillers, it can delay the diagnosis. A combination of approaches to dealing with pain while trying to look at the diagnosis, of course, includes painkillers, but consider diet that may be friendly for inflammation or to reduce inflammation, physiotherapy for the pelvic floor, some form of exercise or yoga that can help with back or other types of pain. Myth number 5 is that surgery is the only fix. Well, this myth is a little bit related to the last one, isn't it? Because we're talking about treatment options. But the point is that there is no single treatment or one-size-fits-all treatment that we can use to deal with chronic pelvic pain and many other medical conditions for that matter. Surgery may suit some causes of chronic pelvic pain like endometriosis or fibroids. However, many other conditions will improve, perhaps with a change in lifestyle, medication, using minimally invasive treatment options, for example, uterine artery embolization with fibroids, and so on. The bottom line, don't ignore chronic pelvic pain. Don't give up when there are not easy, straightforward answers, because it can be a bit tricky sometimes to make a diagnosis of chronic pelvic pain, and you need more than one specialist, more than a gynecologist. You might need a urologist and so on. But it's important that you see your doctor for persistent or worsening pain, if it's also associated with irregular bleeding problems or painful sex or infrequent periods and so on. I really believe holistic care is essential. Watch your daily habits, stay well hydrated, look at easy ways to manage stress, consider core strengthening exercises, yoga or Pilates. Learn and keep track of helpful information, evidence-based information with reputable sites like AskAwayHealth.org. Let me know what you think, or if you still have any questions, drop them for me in the comment section below. Thank you so much for watching. Have a look at this other video if you want to learn more about subjects like this or anything else women's health related, and I will see you in the next one.